Good morning, everyone, and welcome to UHN's Princess Margaret Cancer Centre. Special welcome to our Deputy Premier and Minister of Health, Sylvia Jones, our many partners from government, the Princess Margaret Cancer Foundation, the media, valued members of the team. I'd also like to say a special welcome to Dr. Bettina Hamlin, President of Innovative Medicines Canada, and our colleagues, where have I gone? Ms. Kimberly Clark, CEO of Breast Cancer Canada. So, as you all know, we're standing here at the heart of cancer treatment, the Princess Margaret Cancer Centre. Cancer continues to be one of the greatest health challenges facing Ontarians and Canadians. As populations age, early detection and treatments evolve, the burden of cancer is rising, but also so are our selective conclusions and better treatments. Annually, researchers predict nearly 250,000 new cancer diagnoses in Canada. Our World Health Organization is predicting a 77% rise in new cancer cases by the year 2050. In large part due to our success of treatment, cancer patients are surviving and going on and living longer. But 2 in 5 Canadians will receive a cancer diagnosis in their lifetime. As you know, cancer is Canada's leading cause of death. The average 5-year net survival rates currently sit at approximately 63% for all cancers combined. That's up from 50% in the early 90s and 25% in the 40s. And those changes have all been related to investments in science and the translation of science into new products and treatments that allow Canadians to survive. Ontario has made a number of significant investments this year to enhance its cancer treatment capabilities in our province through advancement in medical isotope production and nuclear energy infrastructure, including a planning grant for Canada's first proton beam facility, for which we thank the Government of Ontario. Princess Margaret is very proud to be here today and to be among the top cancer centres in the world, in large part because of the investment from the Government of Ontario. We're proud to lead ambitious clinical trials, advance new targeted therapies, and advances in new early detection. We also know that timely and rapid access to vital cancer drugs is essential and offers patients more hope. This can easily translate into longer survival, very importantly, better quality of life, and of course, more possibilities for recovery. We're very thankful to Premier Ford, Deputy Premier Jones, and the Government of Ontario for the commitment to strengthening the delivery of cancer care in Ontario, and we share a commitment to ensure that patients can access the latest breakthrough therapies where and when they need them. We're here to talk more about that in a few minutes. Now it's my pleasure to invite Dr. Bettina Hamlin, President and CEO of Innovative Medicines Canada, to share some remarks. Bettina.
Thank you. Thank you. Good morning, everyone. It is an absolute pleasure to be here. What an exciting day for patients in Ontario. But let me begin by thanking Minister Jones, Premier Ford, and the Government of Ontario for their leadership and vision in launching the FAST program. On behalf of Innovative Medicines Canada and our member companies, it is such an honor to be here to celebrate this milestone, a milestone for healthcare in Ontario and for patients who are waiting for timely access to life-changing treatments. The FAST program represents a bold step forward in modernizing how new medicines reach the people who need them. With an initial focus on oncology, it will bring cancer patients access to new treatments up to 1 year earlier. This could extend life, improve quality of life, and in some cases even offer a cure. The benefits of the FAST program go beyond faster access. It's a catalyst for strengthening Ontario's position as a global hub for life sciences, for innovation, and for making a case to invest right here in Ontario. That investment means more research, more jobs, more clinical trials, and future economic growth. The FAST program also reflects a broader cultural shift towards collaboration, shared purpose, and the courage to take on risks. It was only possible through a strong partnership between government, industry, and patient advocates. IMC and our member companies were proud to contribute to the creation of the program. Canada currently ranks last among G7 countries in terms of time to access new medicines. Ontario's action today is a powerful signal that we can do better. Ontario is a true leader in the country and in the world. This is an exciting starting point, and we are encouraged by the government's consideration to expand the program beyond oncology and to share this model across Canada. Real progress happens when we come together with a shared goal and the courage to think differently. It is together, not in isolation, that we build a modern, resilient, and patient-first healthcare system. So, Minister Jones, Premier Ford, thank you for listening to patients, for partnering with our industry, and for showing that bold, evidence-based policy can improve lives for generations to come. At IMC, we will continue to work alongside your government, healthcare providers, and patient groups to ensure this policy succeeds. Thank you very much.
Thank you, Dr. Hamelin. It's now my great pleasure to introduce Ms. Kimberly Carson, who is CEO of Breast Cancer Canada and a distinguished figure on the national and global breast cancer advisory boards and patient panels. As CEO, she has led the establishment of a breast cancer scientific advisory committee and is focused on patient-focused precision oncology research that incorporates AI. Please join me in welcoming Ms. Carson.
Good morning, everyone. What a wonderful day. I'm so excited. And thank you so much to the Deputy Premier and to the Premier and the Minister of Health for speaking with me today and listening to me today. October is Breast Cancer Awareness Month, and we couldn't be happier to be in this position at this time. It's extremely fitting that we're here today to mark the significant step forward in advancing access and breakthrough treatments for Ontario patients. Our latest Breast Cancer Canada national survey that was released last week of Canadians shows that 97% of Canadians believe that patients should have timely access to the same new treatments that are available in other countries. I know today's announcement will be extremely meaningful to Ontario patients. When someone's faced with a breast cancer diagnosis, every single day is crucial. Ontario continues to drive the systemic change that we need across Canada to provide the best cancer care to all patients. And last year, Ontario led by example by lowering the breast cancer screening age to 40, which was a necessary change that is already proving to save lives. We commend Ontario for being the first in Canada to drive the innovation that's needed, that prioritizes patients and ensures everyone can benefit from advancements as quickly as possible. So as we continue to mark Breast Cancer Awareness Month, and in the spirit of today's announcement, I urge the other provinces and territories to follow Ontario's lead. Recognize that science moves quickly and that we need to bring Canadian patients the life-saving treatments that they need and that they deserve. So congratulations to Ontario, the Ontario Minister of Health, for making meaningful progress for patients. Thank you very much.
Thank you very much, Ms. Carson. Well, it's always a banner day when I get to welcome the Deputy Premier and Minister of Health to UHN, and you're welcome every day to make an announcement, Deputy Premier. The Honourable Sylvia Jones is Ontario's Deputy Premier, Minister of Health, and Member of Provincial Parliament for the riding of Dufferin-Caledon since 2007. Please join me in welcoming back Minister Jones and Deputy Premier. Thank you.
Thank you, Kevin, and good morning, everyone. It is always a pleasure to be here at Princess Margaret. Thank you to the Princess Margaret and University Health Network team for hosting us today, and for everything you continue to do to provide exceptional cancer care as one of the world's top cancer hospitals. I also want to thank the many clinicians, researchers, and staff here at Princess Margaret and UHN for your tireless work to improve outcomes and support patients through every step of their cancer journey. Under the leadership of Premier Ford, our government has been making historic investments to protect Ontario's healthcare system, taking bold and innovative action to connect patients and families to more convenient care closer to home. We are expanding hospitals, growing and supporting our healthcare workforce, significantly increasing access to primary care, and improving access to life-saving and life-extending cancer treatments. This includes Ontario leading the country by expanding access to Trikafta, a life-changing treatment for cystic fibrosis, in 2022, and being the first in Canada to publicly fund and administer Pluvecto earlier this year, a new treatment for prostate cancer, connecting even more people to the treatment they need. And we know that we can do more, which is why today's announcement is so very important. Today, I am pleased to announce that our government is leading the world in cancer care by launching the Funding Accelerated for Specific Treatments, or FAST program, making Ontario the first jurisdiction in Canada to fast-track access to breakthrough cancer drugs. Ontario is already recognized as a global leader in cancer care, and the FAST program builds on that reputation. Through this historic program, patients will be connected to life-saving and life-extending treatments up to a year sooner, reducing delays and improving access to cutting-edge cancer care for years to come. On average, as we've heard, Canadian patients wait nearly 2 years to access new publicly funded medicines, a full year longer than patients in other developing and developed countries. This 3-year pilot will expedite access to up to 10 high-priority cancer drugs each year that are approved by Health Canada through the Project Orbis pathway, an international initiative that fast-tracks regulatory approval for promising cancer treatments and therapies. The Fast Track program puts patients first by prioritizing speed while maintaining safety, so Ontarians can access life-saving therapies and innovative treatments when and where they need them. The FAST program also builds on Ontario's leadership in drug access, including our Ontario Drug Benefit Program, which is one of the most generous in Canada, providing coverage for nearly 5,900 drug products to over 9 million Ontarians. Last year alone, our government invested $9.5 billion to ensure people across the province can access the medicines they need, including over $2.7 billion to support access to cancer drugs and related therapies in the community. And today's announcement is one more way our government is protecting Ontario patients and their families. Thank you again to all the clinicians here today and across Ontario for everything you do to support cancer patients throughout their journey of treatment and care. And thank you again to everyone who has come together to support this historic program. Stay well.
Well, thank you, Minister and Deputy Premier. That's amazing news, and literally that is life and death news, as you know. This makes the difference for some of our patients and many, many more patients across this province and hopefully soon across this country. It's now my pleasure to ask my colleague, Dr. Keith Stewart, who's Vice President of Cancer and Laboratory Services at UHN and the Director of the Princess Margaret Cancer Centre, to come and say a few words. One of the great privileges of working at UHN is to be able to work with such remarkable clinicians and scientists as Dr. Stewart. Keith, please bring up the rear. Thank you.
Well, welcome everyone, and thank you so much, Minister Jones. This is indeed a hopeful day for patients living with cancer and for their families. As you know, cancer remains the leading cause of death in Canada, and even as we celebrate improved survival rates, a growing and aging population means an expected higher overall number of cancer cases moving forward. Today, it is even more important then that your announcement offers to accelerate access to the latest and most promising treatment for patients in Ontario and hopefully across Canada, making available new and exciting treatments and advancements in cancer care earlier, saving and extending lives in the process. Recent and honestly amazing advances in safer and more effective personalized therapies and in exciting cellular therapies such as using the patient's own engineered immune cells are revolutionizing care, moving us beyond chemotherapy and creating a world free from the fear of cancer. Today, the Government of Ontario, Minister Jones, you are directly addressing a very real and very significant challenge our clinicians and patients experience every day at Princess Margaret Cancer Centre, University Health Network, and across Ontario, which is the long delay in access to the latest high-impact cancer therapies, readily available earlier in many jurisdictions. Patients and their families can experience great anguish and frustration as they wait for access to life-saving treatments. As others have noted and reported on and discussed today, the current processes in place to make available new cancer medicines across Canada are among the longest in the G20 countries and stem from a sequentially enacted and multi-layered review process, including protracted price negotiations between regulatory bodies and the pharmaceutical and biotech developers, which can add many months or even years to the time it takes for a new medicine to become available to patients compared to those in other developed countries. With this announcement today, Ontario is showing leadership and is taking a bold and much-needed step to address this long-standing problem, setting an example for the rest of the country. It will reduce delays, improve access to important new therapies for our patients, and give our patients and their loved ones renewed hope. It's our privilege to host you at our hospital today, and we thank you for sharing this significant and timely announcement, rethinking how cancer care is delivered. Thank you, Minister Jones, Dr. Hamlin, Dr. Smith, and all of you who joined us today. Thank you.
Thank you, Dr. Stewart. Thank you to all of our speakers. Very glad to have welcomed you here today for this momentous occasion. And mostly, thank you to our Deputy Premier and Minister. Emma Popovic, I think, will now handle any questions you might have for the Minister.
We will now begin to take questions from the media. So all media present, please feel free to line up behind me. As a reminder, the format is one question and one follow-up. And please state your name and your outlet before your question. So thank you.
Hi, CBC News, Tess Ha. Minister, we just had one question. How does your effort fit into the broader plans from the Pan-Canadian Pharmaceutical Alliance to speed up the negotiation timelines? And do you see that collaboration being important to involve the negotiating power of all the provinces, not just Ontario?
Absolutely. So as we move forward, and in fact, there will be a meeting of First Health Ministers this coming next week, and this is certainly on the agenda. We all across Canada want to make sure that access is timely and appropriate for patients and their families. Obviously, Ontario and Premier Ford's leadership pushing this at not only the Council of the Federations, but now with the health ministers. We will continue to make sure that all Canadian residents have access to timely and appropriate medicine.
I just had one follow-up. How much faster would patients be getting access to drugs in Ontario versus in other provinces?
So through the FAST program, we expect to be able to shave off 12 months or a full year. And as I say, some of those discussions and negotiations can be expedited, but we anticipate through this program a 12-month improvement.
Okay. That seems to conclude our media availability, so thank you all for attending.